Nicole, thank you so much for coming onto the show. You are a public health advocate, an educator, and a civic leader from South Central LA. And for 15 years, you've worked with different groups to improve health and prevent disease in some of LA County's most underserved communities. I'm excited to hear about your story, but I'd first love to know what inspired you to get into public health and the nature of your day-to-day work.
I would say that I fell in love with public health about 20 years ago. I was a teen mom. I was pregnant at the University of Southern California, freshman, felt out of place, predominantly white institution, so I didn't feel comfortable. At one time, I was working in food service, making smoothies and banana splits and all sorts of things. And at some point, I realized I needed to get a real job and I needed to take care of my daughter. And so I applied for a job at the health department, and it was a student professional worker position in the sexually transmitted disease program. So I was answering calls from patients that needed help. They were having symptoms, they were having issues. And so I was able to help answer the hotline calls. And while I was there, I was working with people called health educators. That was their job. And I was so like, wow. They're going out in the community. They're doing condom demonstrations. They're really trying to help people live healthier lives. And so while I was there was an epidemiologist that I still actually know to this day, 20 years later. And she said, you have to go back to school and get your master's degree in public health. And I was like, oh man, two more years of school. Oh. She said, do it anyway. 2 years is going to pass by and you will guarantee double your income. And that's really where it all started. And I mean, I got into grad school barely. You know, sometimes it's rough for us, barely got in. And I never looked back. I really am I would say a public health advocate. It's not just a job for me. I really, really believe in the concepts of public health, and it's so important.
And as you already know, a key to being a successful educator and a civic leader is an ability to explain some of these abstract and difficult concepts with language that everyone can understand. I know for myself and many others, we've heard terms like public health and health equity, and there's a sense of, well, I know what the words public and what health mean, but there's still confusion over what the actual concepts mean. Can you break down what public health and health equity mean for our audience and why we should care about these things?
Sure. So public health in a very simple term is really about prevention of disease, promotion of health in communities. So when you go to the doctor, or when I go to the doctor, I'm usually already sick, and the doctor is going to give me something to make me feel better, to cure me. Maybe if there's no cure, so that I don't feel so bad, right? The difference between medical care and public health is we don't want you to get sick in the first place. So we're really focused on how can we keep you from getting the flu so that you don't have to go to the doctor and get a medication or be hospitalized. So we're trying to save people money. And communities can be geographic. Los Angeles County is a community. It could be cultural, people that speak a certain language, children, people that go to school. And so that's what public health is, and like the simplest explanation possible. Health equity now, a little more complicated, but what it really is about is how do we create a society where everybody has the same opportunity to access resources to live their best life, period. So what does that mean? That means that, as George Floyd, for instance, we lost the opportunity to live a healthy life was cut short. What? Police violence. How do we create a system in society where everyone, again, doesn't have that fear of violence or inability to afford housing? How do we make a system or a society that's equitable for everyone? And that's really what health equity is all about.
Okay, so if we're talking about health equity, is this I'm seeing this as sort of a really large scope as opposed to health being narrowed to just diet and exercise, but this is sort of a much larger concept of health.
Yes, it is so much broader than healthcare or me just telling you, you should drink more water. You should stop
Mm-hmm.
eating hamburgers.
Mm-hmm.
You should stop eating Doritos. So those things do have some importance, but for me, it's about I don't really care honestly about what you choose to do individually,
Mm-hmm.
because what I want to do is work to create a society that makes it easy for you to do the right thing. So instead of me preaching to you to eat a certain way, don't eat those Doritos.
Mm-hmm.
Why is it that in certain neighborhoods, in certain communities, all they have are fast food restaurants and liquor stores? So how can I tell you to do a
Mm.
certain thing and eat a certain way if I have the system and the structure for you to do that? If I make it hard for you to eat well, I can't be mad at you if you don't eat well.
Ah, okay. So this is more of looking at things from both a micro and a macro perspective, where you're looking at it from the perspective of like, what can we do systemically to ensure that there are access where people not only have to, it's not that we always have to go to every single person who's dealing with health complications, but we need to create the environment where people can actually do that for themselves if needed.
Absolutely. And I always tell, so we haven't gotten to this point yet, but I teach public health. So this is like perfect.
Mm-hmm.
So I always tell my students, if we spend all our time educating, don't smoke, put the condom on, drink water, don't
Mm-hmm.
eat the Doritos. How long would that take? We
Yeah.
so many people in this country. If we just took this country, for example, we wouldn't be able to do it. There's people that are born every day. So even if we say right now, everybody that exists right now, we're going to educate, we wouldn't be able to do it. So it's easier and better to think about systems level change because it's broader. If we say we're going to
Mm.
raise the age of access to cigarette smoking, we
Mm-hmm.
know that we can, in essence, across the board, reduce smoking among
Hmm.
young people. So that's where public health works. I mean, and of course we do the other typical stuff, disease prevention. Oh, oops, we have an outbreak at a restaurant. Public health goes in to do that.
Mm-hmm.
But yeah, we're looking broader for sure.
Now, another core issue you're passionate about is helping people of color manage their lived experiences at work. I know that we've had plenty of guests on Lag Radio who've talked about their experiences as the lone person of color in the office, but you have some thoughts on how to utilize those experiences to our advantage. Can you explain how this works?
Yeah. So, I think all of us that are Black, brown, people of color, we have this magic. I call it the magic secret sauce. We have this lived experience that, other folks don't necessarily have. And we can use that to our advantage. I'll share a story with you. I was in a meeting at work once, and it was a meeting on race equity. There's all these trainings and things that happen, and we're starting to talk about race equity.
Mm-hmm.
And the facilitators put this huge slide up on the screen, and it said Black people, it isn't this exactly, but this is what it meant. Black people fail in every single system in society: housing, unemployment, we're overrepresented in criminal justice systems, our reading levels in school, we're below reading levels, and all this other stuff.
Mm-hmm.
And so I'm sitting in this room with about 100 other people. I'm not the only Black person in their space, but I'm like, man, what? It hit me in a different way. It's not new information to me. I understand it. I have a graduate degree. I get it.
Mm-hmm.
But at my core, I'm a Black woman. And so there's this idea for me of double consciousness, right?
Mm-hmm.
Understanding things from that academic master's degree level. Yes, I get it.
Mm-hmm.
But then also saying, wait a minute, you're talking about me. You're talking about my neighbors. You're talking about my mama, my daughter. And how do you manage that? So that's one aspect of it. The other thing I'll say is that I'll use that double consciousness when I teach public health to my students who are often white, or I'm their first Black teacher. And so it's really important, I think, to always bring forth that lived experience because it is so valuable. And oftentimes, we are often not at the table when important decisions are made at work about people of color, the people that look like us. And so it's really important to make sure we're there in those spaces that we can say, wait a minute, this is not the way to do this. may want to think about this differently. And I know this for a fact because I'm a member of this community. So it is, and sometimes we get scared for valid reasons, not kind of bring that forward. But I think now is the time. Things have changed. We can now we push forward and push back against a lot of the violence that we've kind of been forced into as people of color in a lot of spaces. I think it's absolutely important and a valuable thing to bring that to people in the workspace, for sure.
Yeah, you made a fantastic point because it reminds me of just the history of how oftentimes science communities being dominated by white professionals leads to very dangerous consequences where you have certain statisticians who are, making false assumptions about communities, saying, oh, well, this community is suffering from this because there is a cultural reason, or because this thing is ingrained where maybe, they don't like to do this or they do like to do that. And it's so important to have different folks from other marginalized communities who can step in and say, okay, well, like you said, where you can combine that academic mind with your sense of, I know what it's like in the community, and I know that some of these issues, it isn't a matter of a cultural thing, it's a matter of a systemic thing.
Exactly. Exactly. For example, in public health, teen pregnancy, infant mortality are issues, especially African American infant mortality. What can you tell me about being a teen mom? I was a teen mom. Like, I'm going to tell you what it was like. I'm going to explain to you how it felt trying to navigate the healthcare system. Or even before I got pregnant, trying to go to get condoms and the condoms were locked up. How did, those things are huge and they're systemic issues. So, yeah, absolutely.
Now, one of the trickiest things for many people of color in the workplace is networking. I know that for any person of color in an office or a professional setting, networking, especially in predominantly white spaces, can oftentimes feel like you're trying to sell yourself short just so you can, make these shallow connections and get that business card or whatever. But I know that there is a better way forward. From your perspective, how can people of color build more effective networks so they can start to grow and develop in their careers?
I think one of the most important things that I had to do was look around. So I've been in my job for 15 years. Look around for your allies. Look for people that have the same thought process as you, that are working toward the same goals that you are. They all don't have to look like you. Some of them can be white. They could be from other races. And I think that it's just important to kind of feel the room and take the temperature, like pay attention and see, like, okay, who's the one that's speaking up? Who's speaking up for health equity or whatever the issue is, of course. And for me, within this last 15 years at my job, I've been so lucky to be able to have a large number of Black women in public health that have been able to sort of actually act as sort of a ladder to help me to move, to push me forward to do better. I also think it's important to have friends that you don't work with, of course, to also be those people. For example, I know a while ago, maybe 2 or 3 years ago, I was like, well, I don't know what I want to do with my life. I think I want to do this thing. I don't know how to get there. And I have a group of 5 or 6 other friends, and they're not all Black, but they're all are women. And they all came to my house with poster paper and they did this whole strategy session with me. Well, let's help you figure this out. So sometimes you pull from your friends around you, and then look for folks at work that are doing what you want to do. I often tell people, don't just talk to the people that are at the same level as you. Think about who's one step ahead. What are they doing? Who are they talking to? What are they reading? And go reach for those folks. I'm also a fan of LinkedIn now. I wasn't a fan before as much, but now LinkedIn is like my friend. I'm like, let me go in here and start talking to people. I'm just going to send this person a message and see what happens. And oftentimes, when people are passionate about their work and are enthusiastic about it, they will share. I've never met someone that'll be like, I want to talk to you. They're willing to share when they care. Right. So I think those are really 3 kind of simple things to think about: LinkedIn, finding your outside circle of folks, and then thinking about who in your workspace that you can look for that's maybe a step ahead of you, to reach out to, and ask for, hey, can you please mentor me? I'm interested in doing these things. And again, if they care about what they are doing and are passionate about it, they will be happy and honored to help.
Perfect. Well, I'm excited to hear more about some of your different ideas and some of the projects that you're working on. But we're going to go ahead and take a quick commercial break. We will be right back in just a second.